Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the YouTube channel today. Once again, here to remind you that if medication fixes your problem, that makes it a medical problem, not a mental problem. You are not damaged goods if you come see a psychiatrist or ask for brain chemistry help. You're simply looking for another type of medical help. That's called psychiatry. That's modern psychiatry. We help people with medicines. Hope that encourages you. Today, I am talking directly to a commenter. A commenter left a question, which was really good, and even though I did manage to type a quick response, I also wanted to, it was a good prompt, so I want to make a video, and the topic is, can you actually get too much serotonin? So if you've watched the channel, if this is your first one, you might want to go back, but obviously, if you've watched the channel, I talk a whole lot about what is a problem when you don't have enough serotonin activity in your brain. So if your serotonin should be here, and it's here. If it's low when it should be normal, then serotonin shortage, the way I talk about treating depression and anxiety, is that typically the picture of low serotonin, if you're here when you should be here, then that's the picture of depressed mood, low interest, low energy, hopeless, helpless, kind of concentrate, lots of anxiety, thoughts of being dead. You don't have to have all of those symptoms, but if you have that big collection of symptoms, that's almost always, as far as we know right now, either serotonin shortage, norepinephrine shortage, or both. So routinely in my office, we use serotonin boosters, previously known to a lot of people as antidepressants, but the medicines don't know if you're depressed. They just know that they go in and boost serotonin activity. They take you from here to here. So the question is, if you have normal serotonin and you take a medicine that boosts serotonin, can you have too much? And do you feel happier when you have too much? Well, the answer is, number one, yes, you can have too much, and no, you do not feel better. In fact, too much serotonin has a name for it. When you have the clinical picture of too much serotonin activity, that's called Serotonin Syndrome. And serotonin syndrome is a variety of medical sickness that is extremely bad and really scary and really dangerous, and which is why some people are concerned that if they take a medicine like this, they might, be very, very dangerous. The fact is, serotonin syndrome is extremely rare. It's something you simply have to be aware of, but the symptoms of serotonin syndrome are basically threefold. Number one, when you get too much serotonin syndrome, you feel, first of all, confused. So the first thing is to recognize mental status changes. So you go from being depressed and anxious to where am I, who am I, what am I doing, maybe feeling confused about your location, not being aware of your circumstance, maybe acting like you're intoxicated or impaired when you're not. So if that happens immediately after you start a serotonin boosting medicine, obviously you stop it. Then when we give a new trial of Prozac or Zoloft or Paxil, Celexa, Lexapro, Cymbalta, we always say, if it makes you some mild side effects, continue. Severe side effects, stop taking immediately. So number one is the confusion, mental status changes. Number two is typically muscular problems. So muscular rigidity, shakiness, stiffness. Sometimes you can actually feel the muscles be tight. And that is often associated with excess temperature, having a fever. So having confusion and a fever, two very scary bad things. And the third thing that actually, if gone unchecked, is lethal, you can die from, is what's called autonomic instability. And basically what that means is the autonomic, the autonomous, the working in the background part of your nervous system, not the part of your nervous system that's thinking about stuff, but the automatic functions like your heart rate and your blood pressure, all that stuff. When that starts to become unstable, then that's where it is an actual medical crisis. So the three things that formally are talked about with serotonin syndrome are mental status changes, muscular rigidity, and autonomic instability. That is to say, blood pressure, heart rate, things like that. Your background body stuff just becoming very unstable and very wrong. We used to worry about this a lot more in the 90s, 80s and 90s. There was a class of medicines that was actually used for depression. It's not used today, to my knowledge, at all, except maybe in very, very specialized, well-controlled circumstances. But there were these medicines called the MAO inhibitors. That stood for monoamine oxidase inhibitors. The names of the medicines were Parnate and Nardil. And I, in my training back in the early 90s, I actually did write probably 10 to 12 prescriptions for Nardate or Parnate Nardil. Sorry, it's been such a long time I forgot how to pronounce them. Parnate and Nardil. But these medicines, by increasing monoamine oxidase, so that's the MAOI, by increasing that activity, MAOIs in conjunction with serotonin boosters can be lethal. So really what you had to do is people had to be on these other medicines. They had to be on specialized diets where they avoided tyramine and other stuff, red wine, sausage, pepperonis, cheese, things like that. Had to be on very specialized diets, and they couldn't take other medicines because of it. So they were so hard to use that really, honestly, they just, in my clinical experience over the last 30 years, have not used them, haven't written a prescription for either of those medicines in private practice. But those would be the ones that if you took them together would actually be life-threatening. So today, it's more the case of if you take a medicine that just doesn't agree with your body and you start to act like it's causing you to be too serotonin active, the solution is stop it immediately, which is what we tell people routinely, and to, if necessary, get to the emergency room because you might need fluid hydration, medical management. But fortunately, with the modern serotonin boosters, Serotonin syndrome is not a life-threatening circumstance if it's recognized. So the nutshell of the question, can you get too much serotonin? Yes. Is it a good thing? No. But it's important to know that if that starts to happen as a side effect profile, that you don't just want to ignore it. You want to pay attention to it. Again, very, very rare, exceedingly rare. I personally have never seen it in my private practice in 30 years. So that means it's pretty rare. So that's what I have to say about serotonin syndrome, and I'm happy to share the information with you, and thanks for the question from the commenter. Again, thank you for liking, subscribing. It's helping other people when you do that, and I'm having a real good experience creating this channel and the content for all the people that watch it, enjoy it, need it, benefit from it, the patients and their families and friends. So I'm Dr. Dave Psychiatry. Thanks for coming to see me today.